Thank you, Satish, and thank you once again for giving me this opportunity to be with you for the second time. And I'm sure the topic that I've chosen today is going to excite one and all, as it really excited me. So, without much ado, I'll just share the screen and start my presentation. Can you see?
Yes, yes.
Okay. So, what I'm going to discuss about today is what our future healthcare would be like, let's say around 2040s or so. So this is my disclaimer, and I really want to use this, that I have utilized images from the net, the different relevant sites as per the topic. The purpose is purely academic and there is no commercial angle or remunerative gain. Now let's see very quickly what is the healthcare today that we are in. All of us would definitely agree that it is more of a sick care system. Once the patient becomes a patient, and then we really try to do a lot of things for them, and then there are lots of errors which are happening. Uh, some are inevitable, some are something which is possible. And then if you look at our medicine today, its prevention or prediction is hardly there. It's totally lacking. And, as far as the involvement of the patient is concerned, of course, it is definitely getting better over the years, but still, there is still not patients much say in the management of the patient. And the cost is also an issue because based care is not amenable to all. So there are lots of things which are there in healthcare, but these are the four things which I thought I should draw the attention to. Now, I'll not go too much into the details because there are even more senior people than me who have been practicing for so many years. And we know there are errors in medicine, either it could be medication or diagnosis issues and so on and so forth, as you can see on the right side. But then the point is that all these errors are inevitable or avoidable. Well, that's a question and that's a debate. Maybe that can go on and on. But the point is that whatever is the reason, you find a lot of medication errors. And if you know one detail which is very, very, startling is that in the United States of America, and I'm sure it definitely would be elsewhere also, the third leading cause of the death was because of the mistake by the physician. So this is something which is glaring. And maybe it's not that the doctors are bad, but sometimes the system that we are using, maybe we are not so good at it, or maybe the system is still lacking in its precision. So let's see. Let me just take you to a scenario. Hi, Bob. I'm George, your virtual medical assistant. Well, I've noticed that your blood pressure and heart rate are remaining on a higher side for last 2 weeks. Please send me the retinal scan from your smartphone app. George, thanks, Bob. Sending it right away. Bob, thanks. Saw the scan. Your genome suggests that you are at a very high risk of having CAD. Have you experienced any chest pain of late? Well, not really, but I had an uneasiness couple of times. Well, I got you. I booked your appointment with Dr. Joseph for coronary angiography on Friday at 4 p.m. Thanks, George. Thanks, Bob. Hi, Suresh. I'm Roshan, your virtual medical assistant. We have completed your genetic sequencing and your prescription has accordingly been generated. I'm sending you the copy. And please note that your medicines will be delivered at your doorsteps on Thursday, 2 p.m. by drone. Welcome to 2040, friends. So let me take you into a world of 20, the future that we are going to not experience. In fact, some of them we already on, and I'm sure all of you are also experiencing that. So let's go to the what the biosensors and wearables are doing to us. Now, when you look at the biosensors, there could be enzyme-based, microbe-based, and immunosensors, and DNA biosensors, magnetic biosensors, thermal biosensors, then piezoelectric biosensors and optical biosensors. Lots of biosensors which are there. And the device is basically made up of a transducer and a biological element that may be an enzyme, an antibody, or a nucleic acid. The bioelement interacts with the analyte being tested, and the biological response is converted into an electrical signal by the transducer. This is a general principle by which all these biosensors would work. Now, if you look at some of the biosensors and wearables, we already know it's happening, especially in the field of diabetes. We are now very routinely doing what the continuous glucose monitoring. In fact, you also find ambulatory blood pressure monitoring, and there are so many things which are already here. And the smartphones now, there are apps which actually let you know your trend of blood sugar. It will let you know your heart rate. It will also let you know your sleep pattern. So everything is on right now, and I think so many phones are getting better and better with better and better apps. So in fact, we are already entered into this kind of era. But then what would be the future? That There would be Bluetooth enabled implants or electronic tattoos. What it can do is that, because it is Bluetooth enabled, these implants would definitely assess your body system, maybe even the genetic structure, or they will also pick up something change which actually occurs very early, much before the symptoms come, and would alert you and your doctor. So this is what is going to happen. And there could be, the bathrooms would be hyper connected. There would be sensors which are embedded in mirrors, which would really continuously monitor your all the vitals, and will let you know if there is any change in that. Or if you go one step further, then you will find that your genetic sequencing or genetic disturbance, or any viral infection attack on you, or any other unusual symptoms, unusual pattern which is found, is relayed, and accordingly it is interpreted. And that's the same thing can happen with the tech enabled toilet, or whether the toothbrush which is has sensor. So don't get surprised in 2040 people would use more time in the bathroom, because that's where their health is going to be decided. And then there would be smart contact lenses. In fact, some of the things have already started. All of us have seen some of the things on a net, that this smart contact lens also would really tell you everything about the patient. So what happens in this is, if you look at this thing very clearly and very minutely, you will realize that all these things and this management is so patient specific. And I think this is very, very important. It's not a one size fit all. It's basically everything according to the patient. And this is going to be the most important part of the future healthcare. Now, because of the time that I have, I just cannot go everything in detail. So I'm just going to take you on a very big, quick, beautiful insight and overview of the time that is going to come. And if anybody is interested, later on, I'll give some references. The artificial intelligence and big data is already making an impact in not only just medicine, but in all our routine life. If you are if you are gone to Amazon, or if you've gone to Flipkart, and then if you are try to do certain even search for some of the things, for example, some kind of a shoes that you want, and you must have noticed that when you go to the Google for any other inquiry, suddenly all those things will pop up, because they have seen your characteristic that you are interested in. So that is artificial intelligence. And big data is also coming big way, because of all the controversies. But then lot of data, when they are collected, by analyzing them, you actually can come up with lots of things, and that is going to be the future. So what exactly is artificial intelligence? Is not one technology, but rather a collection of them. And the most common application of traditional machine learning is precision medicine. All of us know that it is a machine learning or deep learning, which is a part of the artificial intelligence. But the precision medicine, which I was really referring to earlier, is predicting. This is very important to understand, that machine learning is a prediction medicine, predicting what treatment protocols are likely to succeed on a patient based on a various patient attributes and the treatment context. This is a huge thing which is going to happen, and this is going to improve the medical care to a great extent. And deep learning is increasingly being used to radomics, because or the detection of clinically relevant features in imaging data beyond what can be perceived by human eye. I was reading somewhere in one of the books, and they say that what can happen is that what the radiologist or imaging experts cannot see because of the limitation of the eye. It's not that they are not good at it. This particular radomics by deep learning can pick up very, very things which are not even picked up by PET scan. And they can always predict that, well, you are at a risk of something even years before your problem starts. So that is one theoretical possibility which is seen, and this is given the name of radomics. So this is going to be a very, very exciting area, because if your imaging are really, interpreted much before you get the disease, try to imagine what would be the health care. So next, you see that it's already here. Some of you might be aware that the DeepMind is a Google's artificial intelligence. It was developed for the breast cancer analysis. What they did was, a lot of data are fed in, and accordingly the analysis is done, and they come out with the answers. So algorithm is created. All of us know that now it's going to be an algorithm based life, whether it is a driverless car, it is going to be algorithm. So it's going to be algorithm everywhere. So this Google actually created an algorithm, and you know what happened? It outperformed all human radiologists on a pre-selected data sets to identify breast cancer on an average by 11.5%. So that's a huge number, isn't it? So this is just the beginning. So imagine what will happen in, let's say, next 25, 30 years when this technology becomes better and better. Next, after artificial intelligence and big data, is a nanotechnology and medicine. Friends, we are living right at the dawn of nanomedicine age, and it is going to come much faster than you would even expect. What is nanomedicine? In a nutshell, it's the application of nanotechnology to achieve innovations in healthcare, uses properties developed by a material on a nanoscale, and the size offers the potential to cross natural barriers. Now, this is very, very important that it can get into your body. An interaction with DNA or small proteins at a different levels in blood or even in organs, tissues, or cells would enable early detection and prevention and to drastically improve many aspects of healthcare like diagnosis, treatment, and prevention of many diseases. Isn't it very exciting? So, what are the things happening? All of us know about pill cam. Now, we are already using what we call is a capsular endoscopy, where the patient is told to actually swallow the capsule and then it will give you all the pictures. So, we do use right now. So, pill cam is there, where there is a indigestible camera, which is, in fact, by now, 2 million people have undergone this procedure so far. So, it's already on, it's coming, but it's going to be much, much faster than you would even realize. There would be those tracking pills which will give us the sensors relaying the data about how much is the absorption, and then there would be atmo gas capsules which has got a sensor which will detect oxygen, hydrogen, carbon dioxide levels, and gut microbiome. It's very important. You don't have to do blood gas analysis. In fact, you get a very good data from atmo gas capsules from everything that you want, and it would be so accurate and so precise. Then you will have a smartphone microscopes, detecting virus. And so there are certain technology by which you can use smartphone microscopes, and in fact you can literally count the particles of the virus that you are having. Now, this is also another interesting thing which can happen not very far from now is nano patch vaccines. The patches are made from thousands of silicon microneedles, which could offer more convenient and effective vaccine. Imagine no actually needle at all, and this would be more even effective. And the smart bandages, the bioabsorbable bandages, I'm sure the surgeons who are watching here would be excited, is bioabsorbable bandages can be left on until they dissolve. And there would be embedded, nanofibers which can contain the clotting agents or growth hormones. And there would be even sensors which will detect the signs of infection and release antibiotic as needed. So this is something which is so exciting, which is going to come. And friends, this is absolute reality which is going to happen, are called nanobots. We are nothing but a small nano robots. The name given is nanobots. Now, these nanobots are specialized to perform wide variety of surgeries using external magnetic fields to direct bots, like eye surgeries and cleaning blocked arteries and collecting biopsies, to name a few. There will be a lot of more things, many more things which will be happening. Like, for example, there will be cancer fighting DNA. The DNA origami robots target the cancerous cells without harming healthy tissues. Significant result in just 2 weeks. So, friends, imagine a swarms of nanobots swarming through your veins, repairing cells or attacking viruses, giving you everything that you want, every knowledge that you want, the biopsy that you want, the data that you want, just by injecting some of the nanobots in your blood. Isn't it really, really exciting? And then next one, which is going to be very important, is genome sequencing. Now, if you, all of us know that this is very much on, and if you see all the conferences, you'll find that the genome is now getting a lot of coverage for the right reasons, because this is going to be the future if you really want to take our medical care to a great extent, next level. Now, what genome sequencing can do? It will give you a very accurate information about personalized drug sensitivity and effectiveness. It will predict the risk of disease in an individual. It will know about the multifactorial disease and it will give you information about even your family history. So this is going to be very, very important. And like what you found in a previous all areas of future medicine, genome sequencing is going to be the very, very important tool in our armamentarium. Now, this is another very important thing, what they call is a nutrigenomics. Now, what does in nutrigenomics? It's a cross field of nutrition, dietetics, and genomics. Now, in fact, there is a company called Habit. The companies they are already offering personalized diets based on genetic codes. What it will do in future is, that depending upon your genomic structure, they would suggest which food is right for you and which food is not right for you. In fact, to an extent that there would be even artificial food which might be created, as it's not very far from now. So this is what is the nutrigenomics is going to do to all our lives. And most important, which is a pharmacogenomics, all of us know that today, if you give same medicine to two patients, they definitely behave in totally different manner. Why? Because one of the reason could be their genomics. And the pharmacogenomics is going to play a very major role in outcome. It will provide individualized treatment. It will predict, that's very important, it will predict the clinical outcome of a different treatment in different patients, and it would definitely promote the development of targeted therapies. So nutrigenomics, pharmacogenomics is very, very important. And the DNA sequencing giant, in fact, right now, the problem was that when the genome sequencing started, that there was a lot of money which had to be spent, and that's why there was a concern that you can't make it a very common thing because it's going to cost a lot of money. But then the DNA sequencing giant Illumina, actually what they did, that they unveiled a new machine which is expected one day to order your whole genome in less than $100. Can you believe? And in fact, some of the books even mention that you can go down to as low as $10. Isn't it crazy? So this is very, very important. The Ray Hammonds is one of the best futurist. If you really want to go, I'll definitely share with you. Has written about 14 books and in all areas of future, not just medicine. And he predicts that by 2040, every newborn who is born will have the genetic mapping done or genomics done. So this is going to be a real, real future that we are looking at. Then this is very interesting. We call it the in silico drug trials. Now, what are in silico drug trials? They're actually not drug trials on human beings, actual human beings, which is happening right now. But these are individualized computer simulations which are used in the development or regulatory evaluation of medical product, device, or intervention. So while the current technology and biological understanding don't allow for completely simulated clinical trials, there is a significant progress in this field with organs on a chip which are already being put in use. This is going to be huge, because what will happen is that you're not looking at the actual patients and doing the trial. Here are actually simulations and a lot of data that you have. In fact, it would be the big, big data, billions and billions of data that the computer has, which it will analyze, and from that the simulation would be done. So imagine if we could test thousands of new potential drugs on billions of virtual patient models in minutes. Crazy, isn't it? But this could be the reality. So in silico trials are going to be a boon to the medical care in future. Now, regenerative medicine is another very, very exciting area that we are talking about. Now, regenerative medicine is a process of creating living, functional tissues to repair or replace the tissue or organ function which is lost due to age, disease, damage, or congenital defects. In the field holds the promise of regenerating damaged tissues and organs in the body by stimulating a previously irreparable organs to heal themselves. Regenerative medicine also empowers scientists to grow tissues and organs in the laboratory and safely implant them when the body cannot heal itself. Now, this is really, really mind boggling, isn't it? That the regenerative medicine is going to create organs in the laboratory. And this is something very, very important. Then your question would be that what about, the rejection and all that? So regenerative medicine has the potential to solve the problem of shortage of organs available for donation compared to the number of patients that require life-saving organ transplantation. As we know right now what's happening, as well as solve the problem of organ transplant rejection. Why? Because since the organ cells will match that of the patient, as I said earlier, that the entire future medicine is going to be totally patient specific and not one size fits all. So this is going to be very, very important. And imagine the all the organs are available the way you want them, only for the patient, which is according to the patient's need and according to patient's genome. Then imagine what is going to happen. So advances in future medical technology will not just repair physical. Now it's going one step ahead. What is saying that advances in future medical technology will not just repair physical disadvantages such as impaired eyesight, but will also create a superhuman powers from having an eyesight of an eagle or possessing the hearing of a bat. This will have its own problems. I'm sure so many people would be having those questions in mind, but I don't think that we'll be able to prevent this coming. Robots. Many of you are already aware that robots have already made its entry in operation theaters. And it was first 1985, imagine long back, 1985, a robotic arm called Puma. It assisted with the surgery for the first time. And now all of us know that robots are being used even in India. At so many centers, it is being used for heart surgeries, laparoscopic surgeries, and prostate surgeries. And the robots are also not just used for surgeries, but they're also used for aged. For example, a robot called Miro. It reminds to take the medicine. And Robier is a robot from Japan. It helps patients to get out of bed and wheelchair. So that this is another advantage. In fact, robots are also used for giving medicine. Robots are also being going to be used for the disinfections and so on and so forth. Robots are also going to be used to help the nurses in deciding what to whom to give, and all the data will be given by robots to all the nurses, the nursing staff, which will reduce the burden on them. Now, not far from now, you'll find chatbots are nothing but a kind of a robots which are chatting. That you are utilizing the deep learning that I talked about in artificial intelligence will be on hand to assist patients with medical queries. And many of you might have read about this, that right now the most advanced robotic system is a Da Vinci surgical robotic system. The Da Vinci surgical system is a multi-armed wonderbot which is being used to reduce the surgical errors and make surgery less invasive for the thousands of patients. The Da Vinci surgical system gives surgeons more precise control for a range of procedures. I know this is going to really hurt surgeons' ego to some extent, because who knows, in future the robots would be so dominating that surgeon might feel a bit weaker. By 2040, it may be common for surgeries to be carried out by machines under human supervision. With improvements in the speed of network communication, this may eventually mean that a surgeon could perform surgery on a patient thousands of miles away. Virtual reality and augmented reality. This is also going to come very fast. The virtual reality is being used to train future surgeons and for the actual surgeons to practice operations. In fact, it would be virtually created for them. And it would be not three-dimensional, even more than three-dimensional. And such software programs are developed and provided by companies like OssoVR and Immersive Touch and are in active use with promising results. A recent Harvard Business Review study showed that virtual reality trained surgeons had a 230% boost in their overall performance compared to their traditionally trained counterparts, faster and more accurate. Augmented reality differs from virtual reality in two aspects. Number one, users do not lose touch with reality. And number two, it puts information into eyesight as fast it can. So that is what is going to happen. 3D printing, many of you must be knowing, it's already here, but it will have much more, application in the future. Doctors can print biotissues, artificial limbs, peels, blood vessels, and much more. And doctors will be able to practice surgical intervention in advance and models printed through 3D printing. Precise sizing of medical devices is going to be the biggest advantage. The skin grafts for burn victims would be exactly what the patient needs. And the accuracy of prosthesis would be totally patient specific. And that is going to be very important, and better understanding by patients, because that's very important that, by this, you'll be able to make the patient understand much better what kind of prosthesis they are going to receive and what exactly it look like and how it is going to function. The medical tricorder is also another possibility. Another things are happening already. There are some few medical tricorders like the Check Me Pro, which is a palm-sized gadget which can measure ECG, heart rate, oxygen saturation, temperature, blood pressure, and more, which is right in the hands of the physician. The Medband, it's actually in addition to measuring all the things as above, it will also will have a camera for the telemedical purpose. So the doctor has everything in hand and actually pass on to or chat with the patient with the data that patient doctor has. BioSticker can measure a wide range of parameters like respiratory rate, heart rate, skin temperature, body position, activity levels, sleep status, gait, and much more. So these are all the tricorders, but then still, this is still not future. The future tricorders would be high power microscopes with smartphones, for example, analyzing swab samples and photos of skin lesion. Sensors could pick up the abnormalities in DNA or detect antibodies and specific proteins. Internet of Things, I think all of us know these words, and it's happening in all the fields in our human lives. The medical facilities are now brimming with gizmos and teeming with data, but the Internet of Things is getting all these separate elements to talk to each other. So this is going to be important because somebody has to really corroborate with every data that you have. Autobed, for example, is a software for the bed occupancy. It will decide how much is the vacancy and so on and so forth. And I think MRI imaging would also be another kind of tricorder. What it will do is it will give a performing alerts to the doctors, like for example, if they're going somewhere wrong or they are just missing something, then you will find that the alert will come. Big players like Microsoft serving up the enterprise level healthcare Internet of Things packages, it is poised to become an integral part of medical facilities infrastructure tomorrow. A lab on a chip, it's like bringing a lab to the sample. About half the size of a credit card, it contains a complex network of channels smaller than the width of a human hair and can deliver results quickly. It is going to be quick, safe, cheap, and efficient. Not very far from now, mind you. And I've just taken you in a nutshell. There's many things like artificial womb and many things will happen. With the time that I have, let me just tell you that what are the five things which are going to happen. I've already discussed all of them, but if I have to put them in a words of Ray Hammonds, so you will have the personalized medicine, which is based on a personal DNA analysis and electronic health data collected from individual patient. So this is most important, that it is going to be personalized, with the all the things that we discussed from artificial intelligence, the big data, genome sequencing. It is all ultimately going to make the medicine very personalized and at the same time very precise and at the same time very predictive and at the same time very effective. So this is going to be the future. The stem cell medicine is going to, I know that right now in many areas the stem cells are really trying to penetrate in a big way. In some diseases it's giving very good results. In some diseases as of today they are a bit disappointing, but the time is not very far from now that regenerative medicine through stem cell is going to be the future, and the use of the stem cell to repair or regrow tissue and organs. The nanoscale medicine, nanorobots, that is nanobots, as I said, drug delivery and development at submicroscopic level, like nanorobots doing so many things in your blood. And you just have to inject inside your body, and everything will be done by nanorobots so specifically, killing viruses, killing cancerous tissue, delivering medicine, or even taking biopsies and giving your DNA data, so on and so forth. So this is the nanoscale medicine is going to be very important. The gene therapy and gene editing, it is at time is even thought that maybe a bit dangerous, but then this is might happen, is perhaps the time might come where we may not just give gene therapy, but we might even edit gene, that supposing some genes are very dangerous to the health would be changed accordingly so that they don't become harmful to the individual. So gene therapy and gene editing is another exciting future. And digital health, there's so many things like you wearables and biosensors and artificial intelligence and big data, the tricorders and everything which is a digital health. So all this technology to diagnose and monitor patients' health in a much better way, in a personalized way. So you might be thinking that, well, what I'm telling is almost like a Harry Potter movie. Friends, this is what I want to say, that innovations are exponential and perceptions is linear. If you look at our own experience of last 30 years, if you look at how the telephones to mobile to smart app to touch phones to right now, all the data which is going so fast that I think even 10 years before we would not have really thought about what we are using today. The Tesla, for example, some cars are you can just drive. Even today in US, you just don't have to do anything, make it in an auto mode and it will do everything, stopping at the signals and stopping it. So we never imagined this, even just 5 or 6 years back. So our perception is always linear, but innovations are always exponential. So when I say that this is going to be the future, I'm sure you all must have been having many questions in mind, and I also had. So I think there will be new challenges, with this future of medicine, and these challenges will be different from what we are having today. Let's see some of the possible challenges. I'm not saying it will happen for sure, but it can happen. Is a hacking of medical device, because at the end of the day, the human nature is not going to change. Whatever new future medicine technology you do, the people would always be there who always love doing negative things. So there would be hacking of medical devices, could be. And now with this digital thing which is available, it's going to be very easy to ransomware attack on hospital. And some people who are sadistic would otherwise also doing today might introduce virus in entire hospital system, and imagine what will happen, because the entire system depends upon this technology. So if the entire software is really gone, then what will happen to the care? You can realize what might happen. Everything is a Bluetooth enabled technology, like the tattoo or wearables or something which is implanted in your body. What happens suppose there is a crashing down of Bluetooth? Well, they say that it can never happen, but I'm just asking this question. And now the most dangerous thing which I felt was that when the human organs are so easily done, if you read Homo Deus by Yuval Harari, I would suggest that you should read that book, because it's about future. He in fact once said that there could be a scenario that, well, your arm is frozen shoulder, or you have a problem, you just go to the daycare clinic, get your new arm and come out. If it is going to be so easy when the organs are going to be made in the laboratory, as we already saw, then there could be black marketing, because that is something which we have to understand. And when you have a digital health technology, bioterrorism is so simple to do. So that is another area of concern. And privacy, hardly there would be any privacy. Even today we are talking about the privacy problems, but then privacy breach would be there. So these are going to be big challenges in future. But as it happens that we are having some different challenges than what we had about 20 years back. So the world lies like that. I'm sure people would find some solutions to that, but these are few definitely very, very possible challenges that we have to see. Now, when I say that, biosensors and virtual reality and augmented reality, nanomedicine, 3D printing, big data, artificial intelligence, robots, genome sequencing and biomedical engineering and so on, what will be the doctor's role? Is doctor going to be pushed to the corner? Is doctor going to become an insignificant animal in the whole system? Friends, my answer is no. Because, ultimately it is at a VR, AR, biosensor, nanomedicine, everything is going to be interpreted and controlled by a doctor. So don't get disheartened that, well, our role, I still feel that only thing is we will have to improve in our way of recognizing the new and new technology. But at the end of the day, the physician is going to be the key, because the surgery cannot be done without physician, or anything else cannot be done without physicians. So data will be there, but the data's interpretation and putting it in a right way is going to be very important. At the same time, I think it's going to be very important what the government's policy would be, because there are so many future problems. A third thing would be the cost, because if such kind of technology, as Yuval Harari said in Homo Deus, it goes in a very powerful hands, then what will happen? That they are the people who will rule the world, and there would be so many people who will have no job and they'll be free. So this is something going to be very, very important, interesting, exciting, but at the same times, at times, worrisome too. So I think at the end of the day, whatever happens, physician rules the roost, because he will definitely be most important person still, because he will decide which one to do and what to do. So these are the three books I would suggest those who are interested. One is The Future of Medicine by Bertalan Mesco. The middle one is by The World in 2040, is a healthcare mobility travel. This is by Ray Hammond. So I would suggest that you should, maybe you can Google Ray Hammonds. He has written 14 books and is a very famous futurist, as it is called as. And these I have read. I would suggest that the Eric Topol has written a beautiful book called Deep Medicine, how artificial intelligence can make healthcare human again. So these are the books. But then deep medicine is something which is, which you can right now you can see it's going to happen in what is happening in next 5 years. So Eric Topol, all of us know, is a very famous physician in US, and he has written so many good books. And deep medicine I would strongly recommend, which is available on Amazon. So let me end by the Hippocrates uh, quote, that whatever is the art of medicine is love. Wherever the art of medicine is loved, there is also a love of humanity. And I think at the end of the day, whatever you do, whatever is comes on, but I think that that emotional quotient has to be there. Otherwise, you can understand the consequences. So thank you very much for your patient listening. And thank you very much once again for giving me this opportunity.
Thank you, Hemant. That was wonderful as usual. Beautiful presentation and a wonderful topic also to dwell
Thank you.
upon.
Thank you.